They're going backwards on their reopening plan, which is just what we talked about happening. You were in the room many times. I said, if you reopen too fast, what's going to wind up happening is you're going to have to close. And then that's going to be the worst situation. It's going to be the worst for the economy. It's going to be worse for people. And you're going to lose more people in the meantime. That is exactly what is happening. States are now having to roll back their reopening plan. Fact, the buck stops on the president's desk. That is a fact. That's what it means to be the president of the United States. The buck stops on my desk. In this state, the buck stops on my desk. I am the governor of the state. It stops on my desk. It doesn't just stop on the president's desk because he's the president. This is also the words that came out of his mouth. He was in denial of the COVID virus from day one. It's just the flu. It's going to go away. It's going to be a miracle. It's not going up. It's only the testing that is going up. He denied the reality of this situation from day one. Reopen right away, liberate those states. I had all the demonstrations every day, liberate. You're artificially keeping the economy closed. There's no reason. That came from him. You know what's funny in this country? Sometimes if the president speaks, people listen. Even if the president is Trump. Sometimes they listen. And those Republican governors listened. And a lot of Republicans listened and won't wear a mask. He's holding rallies, bringing thousands of people together in close quarters, no masks. What signal did that send to the American people? Couldn't be a problem. Here's the President of the United States bringing thousands of people together, no masks. Can't be a problem. If it was a problem, the President wouldn't do it. Wrong. Buck stops on his desk, and it's what came out of his mouth. He denied the reality of the virus. Well, you know what, Mr. President? Reality wins. Every time. You don't defeat reality. Denying reality does not defeat reality. And he has lived in denial. And he has been denying the scientific facts from day one. He has been denying what every health expert in the United States of America was saying. He denied what his own CDC said. His CDC, when they first projected this March 13th, said at a minimum 2 million people would be hospitalized. At a minimum, his CDC. You know how many 2 million is? The nation only has 900,000 hospital beds. And they said 2 million will require hospitalization. Look at what they were saying. The Peter Navarro memo in late January. 1 million could die. He denied it all. Denied his science advisors, denied the CDC, denied Dr. Fauci, denied them all. Reality wins. And reality won. And now the country is suffering because of the president. And it's time for him to change course. When you're in a hole, stop digging. Will Rogers. It's time for the president to actually tell the truth. The first thing he can do, come clean with the American people, admit the threat of this virus. Admit you were wrong. It's not an admission. Everybody knows you were wrong. Doesn't cost you anything. At least have the courage to admit what everybody else already knows. You were wrong. And send a message to this nation that we have to mobilize our citizens, we have to mobilize our government, and we have to start doing something about this. And you want to take one easy step that will send a powerful message. Put a mask on it. Put a mask on it. Next time you're smiling at the camera, put a mask on it, Mr. President. It's the best thing he could do. Meantime, New York State is doing great. On the numbers, we're doing great. But I feel that there are storm clouds on the horizon. You look at our numbers today, they're still great. 879 hospitalizations, that's 4 straight days under 900, lowest 5-day average since we started the nightmare. Number of deaths is 11. We don't want to see anyone die, but the highest was 800, and 11 is just about as low as it's ever been. The 3-day average on number of deaths, we had 10, 8, 8, and 11. So that's headed in the right direction. We did 56,000 tests yesterday, positive rate of 1.1, which is also very good news. You look at all across the regions, the numbers were all solid and the numbers were all steady. You look even within the city of New York, the numbers are good and the numbers are steady. We don't see any red flags anywhere. We have the data fully analyzed every day. Remember, the key to what we are doing is the testing. People talked about that from day one. Nobody really did it to the level we're doing it. But we just finished 4 million tests in New York. We only have 19 million people in New York. So it is an extraordinary number of tests. And that's what's been guiding us. This is extraordinary to me. But I have a weird sense of what's extraordinary. New York State is doing more tests per capita than any nation on the globe. Look at that chart. South Korea, Canada, UK, rest of the US states, Italy, and look at how many the state of New York is testing per capita. That's the key to our success. If you test, you will find people who are positive. And if you find people who are positive, you then have the tracing in place. You can find out where they got it, you can isolate them, and you reduce the spread. That's how it works. That's how we always said it worked. We just had to make it work, which was the challenge, right? You want to lose weight. Eat less, exercise more. Simple formula. You will lose weight. Caveat, that eating less is hard. That exercise every day, that's a pain in the neck. But you want to manage the COVID virus? Test, trace, masks, social distance. That's the formula. Hard to do. We now have 750 testing sites across the state. Think about setting up 750 testing sites. They never existed before. Hard, but we did it. We're now expanding our testing criteria. We have so increased our testing capacity that we can expand our testing criteria. We prioritized testing criteria in the beginning, if you remember. People who were exposed to a positive person, people who were essential workers, people who were in nursing homes, we prioritized it. We never put members of the press on that priority list. Nothing personal. We are now opening testing to all New Yorkers. We have that much capacity. all New Yorkers can now go get a test. And what I'm saying to all New Yorkers today is, go get a test. It doesn't cost you anything. It doesn't hurt. I did a test. I've done a number of tests. I did a test on TV. I didn't flinch. I cried afterwards, but on TV, I didn't flinch. It doesn't hurt. Take a test. And it's now open to everyone. Capital Region enters phase 4 today. New York City, we have new problems. These are the storm clouds I was talking about. What we have done from day one is we have been smart about what we did in handling COVID. What does that mean? It means we didn't get political, we didn't get emotional, we didn't get hysterical, we didn't panic. We were smart. We did what we had to do, testing, tracing, etc. And also, we anticipated future issues, right? If you're only dealing with the issue you have in front of you, you're going to lose. You have to anticipate the issue coming down the pike, and you have to get ahead of it. In the beginning, I was always saying, this virus has been ahead of us, and we're reacting. We're always reacting to the virus. The virus did this, now we have to scramble. The virus did this, now we have to scramble. You never win that way. You have to get ahead of the virus. So what we now do is we anticipate what could happen and anticipate the issue before it happens. In hockey, they talk about, ice hockey, they talk about skate. Don't skate to where the puck is. Skate to where the puck is going to be, right? Anticipate and get ahead of it. That's what we've been doing with the COVID virus. Factor forward. What's going to happen? How do we get there? Stay ahead of the virus. And we have to stay ahead of the virus. Citizen compliance is slipping. That is a fact. That is a fact. Look at pictures. Look at any street in Manhattan. Go to the East Village, go to the West Side, go to Brooklyn, go to Queens, go to the Bronx. Citizen compliance is slipping. I get it. I understand it. Been inside a long time. The weather's warm. I miss my friends. Governor says everything's good. Governor says everything's good. I bring a mask. I don't really wear it. I do that chin move, you know, the chin move. Feel good that I have my mask. Doesn't do anything. I get why the compliance is slipping. But it is a very real problem. Even if you are young people, and even if the compliance is slipping among young people can get sick. Look around the country. Look at the places where young people are getting sick, and they're now sitting in ICU beds. That was old information and bad information, that young people don't get sick. And young people can infect older people inadvertently. You can go home, see an aunt, see your parents. You can walk past someone, have a conversation. You infect older people. Older people can die. That's what we're talking about. So even if you want to risk your own young life because you believe you're immune and you're a superhero, why would you risk someone else's life? That's a problem. Second problem, government is supposed to be enforcing compliance. That is the governmental role. And that is not happening to a sufficient basis. I have said from day one, we have been clear from day one, local governments don't have any legal authority to determine opening, reopening, of schools, businesses, restaurants, offices. That's not what the local governments do. That's a function of state government. All the openings and all the reopenings, they're done all by the state government. Every county in the state of New York, every city in the state of New York. That's my job. Their job, local government's job, testing, tracing, enforcement of compliance, enforcement of compliance, enforcement of compliance. That is their main job. I take all the abuse for the opening and the reopening. Too slow, too fast. I don't have a problem with that. They had one job: testing, tracing, and enforce the compliance. They must do it. If you have citizen compliance dropping and you don't have local governments enforcing, then you're going to see the virus go up. Period. 1 + 1 = 2. 1 + 1 = 2. And you see it. If you open your eyes, you see the citizen compliance slipping. You see government compliance not correcting it. What's going to happen? The virus is going to spread. It's that simple. It's that clear. That is the reality. The virus spreads. We're back to the mountain. Some of you weren't here yesterday. I'm going to bring my mountain back just to remind you of what happens. I left the mountain in Albany. My bad. I'm bringing the mountain back. Citizens slip. Local government doesn't comply. We're back to the mountain. That is what is going to happen. And that is an inarguable fact. The state's going to create its own enforcement capacity to supplement the local government's enforcement. But I do not have the resources, the personnel, to do this statewide. We have state police, we have health inspectors, we have state local authority, but there are 500 police departments in this state. 500 police departments. I cannot supplement 500 police departments. So the local governments have to do their job. Second problem, second storm cloud, we know the virus is increasing. We have 16 states that are now quarantined from New York. Last week it was only 8. Now it's 16. We don't pick the states. We have a rate of infection. And if a state is above that rate of infection, then they're quarantined. 16 states. That's how fast the infection is spreading. Chances are, whatever we do, people from those 16 states are going to make their way here. And that's how we got infected the first time. We got infected by people coming from Europe through our airports. Now we can get infected by people coming from Florida, Arizona, other states through our airports. Our infection rate is low. We know that. How does it go up? People come in from the outside. Or we start to get lack of discipline on the inside. Phase 3 dining, we are going to postpone. And it's going to be postponed until the facts change and it is prudent to open. But the facts have to change. Because at this point, it is imprudent. Everything else is going to continue. Everything else is continuing all across the state. This is a New York City only modification. because frankly, it's a problem that is most pronounced in New York City. Capital region today goes to phase 4. All the numbers are good across the state, but we do have a problem in New York City. And again, it's partially the other states going up, and we're worried about that. And it's partially lack of citizen compliance and lack of local government compliance enforcement. I've asked the people to do it 157 times. I understand they're getting bored. I've told government that is their job. And I've told them, do your job. If they don't, those two things happen, the virus goes up, period. We're also urging people to wear masks. We have a number of national franchises that are agreeing to have their stores wear masks in the states where it's appropriate. So this is not just a New York thing, wear a mask. We were the most aggressive on masks. We were the first on masks. California just went to masks like last week, believe it or not. So we did it right, and these national manufacturers are now joining with us. We've been following the facts and following the data, and it's working. We did the impossible. We went from worst infection rate in the United States to best infection rate in the United States. Isn't that amazing what New Yorkers did? I mean, it's really incredible when you think about it. And we have offered our help to states across the nation who may need it. Stay New York tough, smart, united, disciplined, most of all loving. Loving. We loving today? Are we feeling loving? If you're loving, you will ask no questions.
Absolutely, we will. So indoor dining screeches to a pause.
So much
and that's
for
a
love.
heartbreaker for the economy, as you know. And so, what aspect of it has to do with the air conditioning? Because if that's true, mall merchants and restaurant owners feel that's a haphazard applying of concern about air conditioning. Is that a factor?
Air conditioning, filtration could be a benefit. It can't be a hurt. It can't be a negative. It can only be a positive, but it's not determinative in any way. They have done studies on air conditioners, and they have filters that are effective at filtering out the COVID virus, or if not the COVID virus, the droplets that carry the virus. But this is just an added benefit. It's not determinative one way or the other. You know, we are just trying to do everything we can. And on the strategy of do everything you can, if you find an air conditioning filter that can help, then recommend it, and I recommended it. You do see across the country, by the way, more and more data that says they're having problems in places, indoor places, with air conditioning, because you're recirculating the air, right? Outside is better. You have more air coming through, moving droplets, etc. The indoor space poses the opposite. You're recirculating the air. And now it gets very technical very fast. When you recirculate, how much new air are you adding? And are you really just recirculating? Because if you're recirculating existing air, and there's somebody who is COVID positive in that air, and then that air is recirculating, well, that's not a good thing. And when it recirculates and it goes through the air conditioning HVAC filter, the
within 60 years. We went from about 100,000 factory workers to probably about 7,000.
Off in the distance, you can see some factories that are still humming, but most of them are just kind of abandoned.
The restaurant industry right now is one of the largest and fastest growing industries in America. And yet it continues to be the absolute lowest paying employer in the United States.
Barely anybody's making enough to live.
You were donating plasma to get by.
It's literally a slave wage.
I don't remember growing up like this. My mom didn't have to go to food banks. It's pretty sad.
The biggest names in politics.
Whoa, that's news. Do we have the capacity to deal with what is coming?
Face the questions you want answered.
Are you looking at a bailout? Can you walk the American people through what happens next? Are you saying you did not ever hear of such a deal? Do you need to level with the American people?
Face the Nation with Margaret Brennan.
These are hard, tiring, taxing jobs, even before coronavirus came.
This is my Clorox wipes, my Lysol. I have no idea what I'm walking into. I don't know if the customers are carriers.
I feel privileged to be out here when so many people are out of work.
Did you ever think that you would find yourselves at the front line?
We have the opportunity to bring something valuable to the community, and that feels good.
We have to be willing to change policy on a permanent basis to recognize and honor these workers.
It doesn't seem like it's worth the risk that you endure every day.
I have to do what I can to take care of myself and my family.
If you had the choice, would you stay home?
Maybe, yeah.
Oh my God, the truck is sinking.
Devastating flooding has reached catastrophic levels.
Rising sea levels are threatening America's coasts.
You would have to take that house and put it on stilts 10 feet tall. If the street is filled with salt water, what difference does it make how high you make your house?
The concentration of the highest rental rates is exactly where the elevation is highest.
This was the evidence to prove that climate gentrification was real.
Pay $1,800 in 5 days or you have to leave. Were you scared?
Yes.
Every single person who stood up and said, I am not paying this rent increase, received an eviction.
Haitians built this place and you're getting kicked out.
Yes.
Turning now to the growing fallout over reports that Russia paid Taliban-linked fighters to attack and kill U.S. troops in Afghanistan. The Trump administration is expected to brief top lawmakers, also known as the Gang of Eight, tomorrow as Congress urges President Trump to respond. However, the White House is downplaying the reports and slamming targeted leaks within the intelligence community. CBS News confirms the president was informed of suspected Russian bounties in his daily briefing, despite reports he does not read the highly classified summary.
The president does read, and he also consumes intelligence verbally. This president, I'll tell you, is the most informed person on planet Earth when it comes to the threats that we face. You have Ambassador O'Brien, who sees him in person twice a day, who sometimes takes the upwards of half a dozen calls with this president. He's constantly being informed and briefed on intelligence matters. But I'm not going to allow the New York Times to dictate when we give top secret information and don't give top secret information. That's an untenable proposition.
On Capitol Hill, Democrats are slamming President Trump not only for refusing to